My name's Jenny Proimos. I'm a paediatrician and adolescent health physician, and I'm doing a PhD looking at the role of professional associations and member organisations in advancing women in healthcare leadership. As a paediatrician who's been around quite a long time, actually, I have had quite a few difficult experiences along the way. I've seen lots of women who have had amazing potential not end up in positions of leadership. And I just felt that it was a wonderful issue and project to really be involved with in order to be able to actually leave a legacy as part of my career, looking up, for younger women. The best way to move forward to advance women in leadership is actually to focus on the organisational and systems levels rather than focus on the individual experiences of myself and of other women who I know. Member organisations are important because they're big cultural drivers in medicine. They actually play really important roles in medical people's lives, and they have the ability, as I said, to hold the health system to account, the health services to account through their accreditation processes, but they also drive medical culture. And so if they are talking about promoting women and advancing women in leadership through flexible training or other supports, then the healthcare services will listen, and also the medical women and medical men will hopefully also listen. Even though they don't employ the workforce, they actually are responsible for training them, continuing professional development across their careers, and for providing all sorts of different skills building opportunities for them. I want to change this for women coming after me because I think there are many fabulous, talented women out there in the medical system who should have the same opportunity as anybody else to be able to rise through the corporate ladder, and the system can benefit from the skills that they have. A mentor or a sponsor could easily have been someone who I worked with closely, other senior doctors in the hospital in which I worked, or in government, because I worked in government for a very long time, but someone who I felt had my back and was willing me to advance along the sort of the career hierarchy in a way that was going to benefit me rather than benefit them. I think if I had been actively supported through my career, I probably wouldn't have had as meandering a career as I have had, successful though it has been, and I would have had other opportunities to actually grow in the academic hierarchy, which I felt were closed off to me at the time. I've moved on, and I'm lucky that I've been able to move on in as much as I'm now doing this research towards the end of my career rather than at the beginning of my career. And that provides me with some flexibility and to be able to bring, I guess, the experience of a long career to the issue, but also because I do also feel that I can change the system for those who are coming up behind me. And to me, that's incredibly motivating. The old system that I grew up in is not the system that exists today, and I have an opportunity to change that system, and that's what I want to do. What would I tell my younger self? I would tell my younger self that doing medicine is an extraordinary privilege, and so you made the right decision when you were 9 to want to be a paediatrician. But don't take things too personally. A lot of the issues are related to the system or the organisation in which you're working and the culture in which you're working. And to try and back yourself a bit more. Find a mentor who you trust and, take chances when you can.